This is our automatic ABI machine, eZyABI. It does not use any Doppler sensor. It uses just 4 blood pressure cuff, and it measures the ABI within 3 to 4 minutes. We also have TBA option. So in that, if you have the TBA device, then you will have 2 more cables for the right toe and left toe, but this is an ABI device. You can do Ankle-Brachial Index. So you can see here, right arm red color, right leg black, left arm yellow, and left leg green. Like it's an ECG electrode color coding. Based on that, we have the color. Just you have to match the color. So just press it, it get locked. Okay. And on this side, you have 4 cuffs connected to the patient. So no more sensors, only the cuffs. So this cuff placement is important. You can see that the wire termination, it should come the bottom, and also it should come on near the posterior tibial artery line actually. The same way you can see here, down. Okay. And if you look at the arm, same way down near the brachial, and for the other arm also the same. So just tie the cuff. You should not over tight, you should not be loose. If you insert your finger, you should be able to go with little strain. If it is very loose, it will easily go. Okay. Otherwise it will not enter, so that means it's too tight. If the patient is wearing a pant, better to move the pant. You should put it onto the bare body. The same way in the arm. If he is wearing a shirt, full hand, you can ask him to remove and then connect it. So that's it. Now we will see how the device is connected to the computer and the recording is done. So this is the screen. You can see here automatic ABI machine, eZyABI on the top, and then device connected, COM number with the USB symbol. That means the device and the computer got connected. And there are a few menus here. You can see new. Whenever the patient comes for the first time, select new. And again, if the patient comes after 3 months or 6 months for a review, then you have to select old. So you select old, and then here you can type in the name or ID, and then use this search bar. Then it will give you that particular selection patient. So then you can start doing the test. Okay. So if the patient comes 5 times, 6 times, then under the same ID, the same patient 6 visits data are stored. So it's easy for you to do the comparison. Okay. Edit, for editing some patient details after you complete it, or if you feel that one particular arm or leg, you feel that you have not done the proper waveform or proper BP measurement, you can select and you can edit that particular location or the entire report. Delete for reporting the complete database. I mean that particular patient data, not all the data. Report, you are giving a physical report to every patient, so you will be keeping it in the file. And suppose if we are not having the report, then you can select the report. The system will have all the patient reports, so you can just select the report. I mean the entire patient data will be there. Select by ID or by name, then you can review all the information. Okay, now you can see you are seeing the ABI. So that way you can, the database there, you can use the database. Hospital setting, this is useful for setting up your letterhead. So we can create your letterhead. So hospital header, by default our name and address will be there. So you can select everything and then you can type your own. Okay. And then you will have it. Okay, I am exiting without saving. Okay. And again for Logo, by default our logo is there, you can delete it, and then you can add your logo. You have the facility to add your logo on the left side or the right side, or if you have two logos, one for hospital, one for maybe NABL accreditation, then if you want to have that, then you can have multiple logo, two, maximum two. And then consultant, I have already have two consultants. If it is a single owner, then only one name will be there. If it is multiple consultants, then we can add as many as 10, 15 also. So this will, while they do the testing, we can select the consultant name. Okay. If you want to add, just add a new, type the doctor name. Don't type doctor because already doctor is there. Only the doctor name and his specialization, and then save. It will get added. Okay. Application settings, there are a few settings. One is automatic ID. Many hospitals, they don't have unique ID for every patient, so they just randomly give some number. In some hospital I have seen they put some 100 for every patient. So when you want to do a search, when you put ID of 100, then there will be 100 patients for the same ID. So by default we make the ID on, so that the computer itself will create an ID for every patient, so there will not be any duplication. In case if you have ID for every patient, then you can make it off. Then it will ask you to type in the patient ID. Okay. And then interpretation on off. So the device, the software will, based on its reference, it interprets the data normal, mild, moderate, like that. If you don't want the system to do it, then make it off. Report title. So this is how the report will have. In case you wanted to change the report's title, you can change it here. Okay. And then backup. So you want to move the software to another system, or you expect the system is having some problem, you wanted to service it. So you want to take the backup data, then you put external drive and then backup, and then the data are stored in that external drive. Then after you install it in the new computer, you say restore from that backup device, you can take all the data back to this system. Okay, email export. Most of the hospitals are not using, so we made it off by default. In case you have the habit of sending the patient data to someone, you can make it on. Recording mode, usually by default it is auto. Manual, if you want, you can make it manual. So by default it is automatic. So that's it. Here we have user manual in PDF and also a demo video. In case you want, you can see the demo video. So now let's start with new. So you have to select. Okay, and then age. Yes. Then gender, and then I click the patient, consultant name. Multiple names are there, then I can select one of them. Automatically the specialization also comes. Now it's ready for testing. I click eZyABI. You will get a new screen. While doing the test, patient should not move, should not speak, because sometimes the data will get corrupted when he moves. So ask the patient to lie down calmly and don't interfere with the patient. Let him just sleep, or lay down. So here you can see locations: right brachial, right ankle, left brachial, left ankle, and if you have the toe in your device, then you have the left and right toe. Okay, and the gain 1. In case if the PVR is waveform is taller or small, then you can change it. Okay, normally you will have a good waveform, but some patients will have a larger height. In that case, we can reduce it. Okay, so here one more important thing is spot availability. Okay, let's assume if the patient comes with one amputated legs. Maybe the left leg is not there. Okay, below knee amputation is there, so you don't have space to keep the cuff to measure. So in that case, you have to select spot and then remove left ankle. Okay, and then confirm. Then the measurement will be done only for the two brachial and the right ankle. Okay, so but I am selecting all the four. So because I wanted to do all the four. So now the test will be done for all the four. Just click once, record BP. That's the only thing you have to do. Nothing else. There is no probe, Doppler, PPG. You don't have to hold it on the patient. Just simply click. The moment it click, you can see the BP starts inflating. You are getting the real time data. Sorry, there's a loose connection on the cuff, I think. Okay. Yes, now you can see it's inflating. Yeah. It takes less than a minute to get complete pressures. It will give you systolic, diastolic, mean arterial pressure, pulse pressure, and also the heart rate. So now it's time to show the BP. Yes, it's showing. Now you will see the PVR waveform. It's getting taller, so I just reduce it. So once we check for 5 seconds and then waveform is getting recorded. Now you can see here right ankle. From right brachial it changed to right ankle. So the measurement is on. You can see the BP goes up. So now the deflation starts. Okay, now the waveform is going to start. So I'm changing to 0.5. Okay, so 5 seconds, then it starts recording on its own. Then you can see now it becomes left brachial. BP started. Deflation started. So maximum 3 to 3.5 minutes. It does all the 4 limbs and then it calculates the ABI. So you can see the waveform. Now it's getting ready. So I'll change it to 0.5. 5 seconds and then it starts recording on its own. Now BP for the left ankle, the last location. Inflation stops, deflation started. So no intervention, I don't do anything on the patient side. Patient just relaxed. So now the BP is done. Okay. So its recording is going to happen. So now this is done. That means everything is done. So now just save, preview. You can see the preview now. I will make it big. Okay, see the logo and hospital name. Our name is there, but you can change it. Patient details, the visit time, the visit number. Okay, left, right brachial, left, right ankle waveforms are there, PVR. And then on the right side, you see the normal, mild, moderate sample waveform, how it will look like. Left side, the resting values are there. Systolic, diastolic, mean arterial, pulse pressure, and then the heart rate. And then on the below that, you have an interpretation. Okay, it says 0.94, it says borderline. And then based on that, it gives you a trending graph and also interpretation. The bottom you will have doctor name and the specialization. Okay, so this is how the report will look like. So just took 3 minutes to complete one test. You can, from here you can print. So it also helps you to do exercise ABI because it says borderline. So this is enabled. Otherwise you will not find, if it is normal, you will not find exercise ABI. If it is mild moderate also, you will not find. Only when there is a borderline, exercise ABI menu is there. In that case, you have to ask the patient to do a treadmill walk, do a calf rise for about 5 minutes, or climb on a staircase. Immediately do the ABI one more time, and then it tells you whether it is normal or whether it has got a underlying PAD. Okay, so I go to home, go to the main screen. Here I can print. Here also I can see the preview. Okay, so I will see the same preview here. That's it. So I can also directly print it. Okay, so one last thing, if you want to do how from the next visit, so you can just click, select the name and start the test. So you will go to the next screen. Okay, here the same procedure. So you will be completing the full test. So like that, whenever the patient comes, search the patient and then go to the vault, search the patient, and then you can do the test so that the data are stacked multiple times for it to easy for review. Okay, so that's it. We have completed the simple automatic eZyABI, just 3 minutes. No cuffs, no Doppler probe sensors. Don't have to look for the sound waveform. Just 4 cuffs. Just say record BP serially in 3 to 4 minutes. It completes one full test.